Welcome to the Rapid Antigen Test course, Supervisor Training. These rapid antigen tests do not require medical professionals, such as nurses, to administer. It is a simple skill for employees to self-collect a specimen by swabbing their nostrils. The Chambers of Commerce, Boards of Trade, and other distribution partners are working with the federal and provincial governments to distribute these free rapid antigen test kits to businesses in their communities. This course has been designed to train those people supervising the program at each workplace on how to conduct the tests, interpret the results, and report the information to the government. In this course, you will learn how rapid antigen tests work, the reason for completing rapid antigen testing, the equipment and setup required, safety and PPE, quality control needed in the testing preparation and setup and while conducting the tests, the steps to perform the self-collection, interpreting the test results, and what to do if the results are positive or negative. How antigen testing works. Here's the quick story. It is legislated that all workplaces must screen their staff and any essential visitor. They must keep those records to share with public health as requested if there is a risk of a COVID exposure. However, some people who pass the daily screening assessment may still have COVID. They are referred to as asymptomatic shedders. People that don't have any signs and symptoms but are still contagious and can spread the COVID-19 virus. It is believed that approximately 33 to 50% of all cases are spread by asymptomatic shedders. A rapid antigen test looks for the presence of a protein that can only be found on a living COVID-19 virus. The rapid antigen test allows people to self-collect a specimen by rubbing a swab in their nostrils for several seconds. Within 15 minutes, you will know if the protein is present and therefore the person is positive. If the protein is not present, then the result will be negative. With this knowledge, a business can provide a safer workplace and give employees and customers greater confidence knowing that there is no asymptomatic shedder on site. All right, let's look at how the program works. Testing errors do occur. Therefore, before testing, do not freeze the kits. They should be stored between 15 and 30 degrees Celsius at least 30 minutes before testing. Screen the people who are going to be tested before the testing starts. Confirm the kits have not passed the expiration dates. Discard any damaged or open test materials. Establish a testing location and ensure the test surface has been disinfected. Ensure the self-collector has washed their hands for 20 seconds or used hand sanitizer and wear the appropriate PPE. During tests, ensure procedures are carefully followed. Use the test procedures in the reference guide. Perform quality control. Use the positive or negative control swabs to confirm the buffer is working. Do not mix buffer fluid from one different lot with another. Use the container that came with the box of 25 test kits. Ensure the correct amount of buffer fluid is added in the extraction tube. Perform the test immediately after removing the test device from the foil pouch. The swab specimen should be used immediately after collection and placed in the extraction tube. The swab cannot touch any other surfaces, only the person's nostrils and the extraction tube. The testing area or station setup is a critical part to the speed and ease of use. Set up the tube rack and set out the swab, extractor tube, and caps needed for each test. The table or surface should allow the supervisor and staff member to be a minimum of 6 feet or 2 meters apart, and a preferred method would include a plexiglass barrier separating the individuals. Internal quality control is essential to protect the safety of the staff and the accuracy of the tests. Before testing, employees perform 2 swab tests, one with each of the negative and positive control swabs. These are not to be reused. The control swabs are performed once per box. Once the control swabs have been completed, the box of 25 swabs is considered good to use and should be used within 30 days. If there are swabs left after 30 days, the box is to be discarded and a new box is to be used. Hand washing for 20 seconds or the use of hand sanitizer must be conducted by the test program supervisor when changing gloves between tests and by the employee upon their arrival and before leaving the testing station. The testing supervisor is required to wear a mask and gloves when handling any of the test equipment or materials. Do not let the soft swab tip touch any other surface other than the tester's nostrils and the inside of the extraction tube. Now we will look at the various steps to follow the self-test procedures. Step 1. Hold the buffer bottle vertically and fill the extraction tube with the buffer fluid until it flows up to the fill line of the extraction tube. A note of caution: if the amount of buffer is insufficient or excessive, an improper test result may occur. Step 2. Place the extraction tube in the tube rack. Step 3. The employee may hold their head straight up or tilt their head back approximately 70 degrees if they would prefer. Then gently rotating the swab, the employee must insert the swab just less than an inch or about 2 centimeters into a nostril until resistance is met at the turbinates. Rotate the swab 5 times against the nasal wall, then using the same swab, repeat the collection procedure with the second nostril. Slowly remove the test swab from the nose and insert the swab specimen into the extraction tube. If the swab stick breaks during the specimen collection, repeat the specimen collection with a new swab. Step 4. The supervisor will swirl the swab tip in the buffer fluid inside the extraction tube, pushing into the wall of the tube at least 5 times. Then wring out the swab by squeezing the tube with your fingers. Step 5. Break off the swab at the break point and close the cap on the extraction tube. Let the swab sit in the test solution for 2 minutes. Step 6. Open the dropping nozzle cap at the bottom of the extraction tube. Step 7. Dispense 5 drops of extracted specimen and buffer fluid vertically into the specimen well on the test device. Do not handle or move the test device for 15 minutes until the test is complete and ready for reading. Caution: if bubbles occur in the extraction tube, this can lead to an inaccurate result. This may be caused by clogging in the dispensing nozzle, and to solve this, turn the extraction tube upside down to remove the swab from the tip of the well. Then turn the tube back and reattempt to place the drops on the device. Step 8. Close the nozzle. Start the timer. Even though lines may start to appear in the CT window, you should wait and read the results at the 15-minute mark. Do not read results after 20 minutes has passed, as the test becomes invalid and must be taken again. Step 9. Affix a label with the self-collector's name to the test device to avoid any confusion identifying which test belongs to which person. Interpreting the test results is one of the most important aspects of the program. The test device has 2 lines, the control line, C, and the test line, T. The presence of the control line proves the test device is working. The presence of the test line, T, proves the COVID-19 virus is present and therefore positive. The absence of the T line indicates COVID is not present and therefore negative. For a negative test result, meaning that COVID was not detected, the presence of only the control line C and no test line T within the result window indicates a negative result. The employee may remain at work as the COVID virus was not found. The presence of the control line C and test line T within the result window indicates a positive result. A word of caution: the presence of any test line T, no matter how faint, indicates a positive test. If this happens, the employee must leave the workplace, contact public health, and report to the local COVID-19 assessment center for a PCR test. Follow your organization's Infection Prevention and Control, or IPAC guidelines, including quarantine protocols. Use a daily screening tool to provide public health an accurate list of people potentially exposed over the past number of days. If the control line C is not visible, after 2 minutes within the result window, following the 5 drops being put on the test device, the test is considered invalid. It is recommended to read the instructions again before retesting the specimen with a new test device. Step 10. During and after each test day, record the number of tests given and the results of those tests. Talk to your distributor about how to share this information with the government. Step 11. Once the testing has been finished for the day, it's time to put things away. Clean up and disinfect the area. Dispose of any PPE and disinfection materials. Put the remaining test kits in a safe storage area. Consider PPE and supply inventories and reordering test kits when 75% of the kits have been used. Thank you for taking the time to complete this very important training and to help reduce the risk of COVID and keep your business safe and operating.